The phrase no pain, no gain means that in order to achieve something, you have to go through something difficult.
So it's a thought process many use when it comes to physical activities like running, swimming, lifting weights, but pain can also be a signal to slow down. There could be an injury.
Yeah, depending on your diagnosis, there are different types of treatment that are available. Morning anchor and health reporter Kirsten O'Connor is standing by now to ask a doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
And we want to specifically talk about those pains that may not require surgery. So we brought in Dr. George L. Derry with Orlando Health Jewett Orthopedic Institute to talk more. Thank you so much for being here.
Thank you for having me.
So talk to me about the patients that you treat.
So I treat patients of all ages. I originally trained in primary care, so I'm very familiar treating patients young and old, primarily those who are active, or trying to be more active, who are having pain in a joint or an injury from a sport or an activity at home or even in their workplace. So a whole slew of different people.
Yeah, and it's fun for me to talk to you because at one point I was a fitness instructor, believe it or not. There was a time. And I remember that feeling of, the pain of soreness, right? But then there's also the pain of, I think I may need to go see a doctor.
That's right, yeah, and pain is part of athletics and sports and exercise. It's something that everybody is going to experience in their lifetime. So determining whether it's a good pain or bad pain, sometimes a little difficult, and that's where we come in sports medicine, and we're able to kind of tease that out. If you're working out, you're going to be sore. You're going to have some pain in your joints. You're going to have some pain in the muscles, and sometimes that's a good thing to get muscles to grow. But pain that really stops you, or sharp pain, or I tell people typically pain where they can say this is more than 3 out of 10 strength of pain, is probably not good. You may be making something worse, so you may need to see your doctor and talk about them.
Yeah, we used to even say to our clients, chase the shake, because you wanted to feel that almost, your muscles starting to change, and that was a good thing. But when you can't catch your breath or something has changed, you do know the feeling, right?
Yeah.
Most of your patients probably come to you and they know something's wrong.
Yeah, particularly in exercise, if you are able to exercise and get that burn and follow through with your exercise and not really lose your form, it's not typically a problem. But when pain is really stopping you from getting those reps to maintain good form, that's where problems happen, and that's where other injuries can happen too.
Yeah. So what are some of the treatments that you do that, don't require surgery? Because we were saying some people are really opposed to surgery, and there's a lot you can try beforehand.
Oh, absolutely. And I think that's why it's important to see a specialist in that field to really hone in on what your problem is, because there will be a lot of things that will be safe to do and continue to exercise through, and there'll be other things that would be a problem. When you have certain conditions, some of them, they just require surgery. It is what it is, a big, terrible broken bone, a bad ligament tear, something like that. But there's a lot of other little things with strains, sprains, or even just inflammation in the joint that we can try to manage and treat non-surgically. And that's where it's good to figure that out.
And I know that you treat some professional athletes too. How does that change the game for you when you know that a strain or a sprain could potentially change their entire career?
Right. In professional athletics or even high college athletics, the stakes are higher. So you need to know fast. You need to be able to react fast. The treatment needs to happen fast, because we're talking about days lost can make a huge difference in a season or in a player's career. In the general population, typically I don't treat them any differently. I provide them the same resources and options of treatment. The difference is having availability to those resources, being able to find time to do the physical therapy or the rehabilitation that it requires. Professional athletes are going to be doing that every day, all day, focusing on getting better. Whereas the general population has a job, they have a family, they have things to do. So it takes a little bit longer. We have to mediate it a little bit, but I honestly treat them almost exactly the same with the same types of treatment options.
And some of this technology is new. So, if you were an athlete in high school and you had to go and get a physical and realized that you had something that needed some treatment back in the 80s, it may not be the same now. We're talking about, using an ultrasound as a way to help.
Yeah, the world of ultrasound-guided diagnosis and treatment has really evolved and has become a huge part of our practice in sports medicine. Nearly any time I need to do a procedure or an injection, I'm using ultrasound to guide it to make sure it's in the perfect spot, that we're hitting the right tissue, and then I know and the patient knows that that treatment was perfectly guided and effective. So it's a huge part of our practice. We do it all the time, and I think if the athletes benefit from it, why wouldn't everyone else?
Yeah, it's nice to know that you're being treated like a professional athlete.
Yeah,
That should
exactly.
just give people some confidence.
That's right.
Well, thank you so much for being with us.
Yeah.
It's a pleasure to speak with you, and I'm sure we'll have more Ask a Doctor
Yeah.
segments
Thanks
soon.
for having me.
I'll send it back to the ladies at the desk.